This is ASH News TV. I'm Rachel KOPCZYK.
And I'm Ed HEILAND. Scientifically and clinically, the study of blood disorders requires a profound level of professional engagement.
And that can lead hematologists to lose sight of complex notions held in the non-medical world.
To highlight the intersection of hematology and the humanities, the editors of The Blood Journal invited TV journalist Tom Brokaw to share his story of what cancer does to you and for you.
We feel connected with you because of your professional career in journalism, dealing with global problems, and with your background as a patient. And we feel that you have acquired a unique perspective.
Brokaw, best known for anchoring NBC Nightly News, discussed his experience living with multiple myeloma.
And I couldn't ask for anything more. And then I was diagnosed with multiple myeloma, which is potentially fatal. But the fact of the matter is, as I said at the outset, it put things in perspective for me. It reminded me of what others go through and how they deal with it.
What's new in the treatment of multiple myeloma? New epigenetic regulation research might be the key to new treatments. A session hosted by the ASH Scientific Committee on Plasma Cell Neoplasia looked at the fundamental role of perturbations of transcriptional regulation and chromatin structuring in malignant transformation. According to Dr. Jonathan LICHT of the University of Florida, new research into the mechanisms behind enzyme mutation could lead to new treatments for multiple myeloma.
The components of the gene regulatory machinery are frequently mutated in myeloma. Understanding these fundamental molecular mechanisms, we could understand ways of developing new therapeutic strategies.
Palliative and end-of-life care are critical dimensions of treating cancer patients. Here's a look at how hematologists can provide even higher quality care. A special symposium on quality reviewed recent evidence regarding the challenges of delivering and measuring high-quality palliative care for patients with blood cancers. Speakers reviewed existing quality measures for end-of-life care and addressed controversies regarding how quality is measured in the context of pediatric and adult hematologic malignancies. Dr. Anthony O'Brien says palliative care has begun to play an even more important role in cancer care than in recent years.
We're now moved to a situation where the early integration of palliative care into disease management pathways, oftentimes the moment of first diagnosis, has made a tremendous impact in terms of patient quality of life, overall satisfaction from the patient and the family perspective, reducing costs, and in certain circumstances, an improvement in survival.
The barriers to incorporating this type of care were also discussed during the ASH Practice Partnership Lunch, where speakers offered these strategies.
We're talking about some of the cultural barriers to palliative care integration in hematology and hematologic malignancies, specifically surrounding the misperception equating palliative care with just end-of-life care. And palliative care is a lot more than just end-of-life care, and so a lot of the focus is on some of these cultural barriers and how to overcome them.
One example is how to embed a palliative care clinician into your practice. There are some successful programs that have hired or utilize hospital-based palliative care providers to come to your clinic once a week and see patients that might benefit from palliative care in that way.